This medication, Jornay PM 100 mg capsule, is used to treat attention deficit hyperactivity disorder, ADHD. It works by changing the amounts of certain natural substances in the brain. Methylphenidate belongs to a class of drugs known as stimulants. It can help increase your ability to pay attention, stay focused on an activity, and control behavior problems. It may also help you to organize your tasks and improve listening skills. The recommended starting dose of Jornay PM is 20 mg once daily in the morning. The dose may be increased by 20 mg per day at weekly intervals. The maximum recommended dose is 100 mg once daily in the morning. It is important to take Jornay PM at the same time each day, preferably in the morning. You can take it with or without food, but it is important to swallow the capsule whole or sprinkle the entire contents onto a small amount of applesauce. Be sure to take Jornay PM exactly as prescribed by your doctor. Before starting to take Jornay PM 100 mg capsules, be sure to read the medication guide provided by your pharmacist. It's important to take this medication as directed by your doctor, usually once daily in the evening between 6:30 p.m. and 9:30 p.m. It's best to take this medication with or without food, but be consistent with how you take it each time. It's important to swallow the capsules whole and not to break, crush, or chew them, as this can lead to increased risk of side effects. However, if you have trouble swallowing the capsule, you can carefully sprinkle its contents on a spoonful of applesauce and swallow the mixture right away without chewing it. Be sure not to drink alcoholic beverages while taking this medication, as it may increase the amount of the medication in your body and cause serious side effects. Take this medication regularly at the same time each day in the evening to get the most benefit from it. The dosage is based on your medical condition and response to treatment, and your doctor may direct you to gradually increase or decrease your dose. It's important to not suddenly stop using this drug without consulting your doctor, as doing so may lead to withdrawal symptoms. If you have used this medication for a long time, talk to your doctor before stopping. Also, be sure to tell your doctor if your condition does not get better or if it gets worse. Some common side effects of Jornay PM 100 mg capsule may include nervousness, trouble sleeping, loss of appetite, weight loss, dizziness, nausea, vomiting, or headache. If any of these effects persist or worsen, it is important to consult your doctor or pharmacist. It is important to remember that this medication has been prescribed because your doctor has determined that the benefits outweigh the risks of potential side effects. Many people using this medication do not experience serious side effects. This medication may also raise your blood pressure, so it is recommended to monitor your blood pressure regularly and inform your doctor if the results are high. Contact your doctor immediately if you experience any serious side effects, such as signs of blood flow problems in the fingers or toes, unusual wounds on the fingers or toes, fast or irregular heartbeat, changes in mental/mood/behavior, uncontrolled muscle movements, sudden outbursts of words/sounds that are hard to control, or vision changes. Seek immediate medical help if you experience very serious side effects, including fainting, seizure, symptoms of a heart attack, or symptoms of a stroke. Rarely, males, including young boys and teens, may experience a painful or prolonged erection lasting 4 or more hours while using this medication. If this occurs, stop using the drug and seek medical help right away. A serious allergic reaction to this drug is rare, but if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, severe dizziness, or trouble breathing, seek medical help immediately. This is not a complete list of possible side effects, so it is important to contact your doctor or pharmacist if you notice any other effects not listed above. Using Jornay PM 100 mg capsule, delayed release, extended release sprinkle for attention deficit hyperactivity disorder, ADHD, should be done with caution. It can be habit-forming and may cause serious heart and blood pressure problems if misused. People with mental/mood disorders or substance use disorders should use this medication carefully. It's important to not increase the dose, use it more often, or use it for a longer time than prescribed. Your doctor may also monitor you after stopping the medication, especially if you've been taking it for a long time or in high doses. Before taking Jornay PM, it's important to discuss any allergies with your doctor or pharmacist. You should also inform them of your medical history, including any heart problems, mental/mood conditions, overactive thyroid, seizure disorder, and throat/stomach/intestinal problems. This medication may cause dizziness, so it's important to avoid alcohol or marijuana and to use caution when operating machinery. If you're planning to have surgery, make sure to inform your doctor or dentist about all the medications you are taking. If used for a long time, Jornay PM may affect a child's growth rate, weight, and final adult height. It's important to monitor these factors and consult your doctor for more information. Older adults may be more sensitive to the side effects of this medication. During pregnancy, Jornay PM should only be used when clearly needed, and it passes into breast milk, so consulting with your doctor before breastfeeding is advised. It's important to be aware of potential drug interactions when taking Jornay PM. Make sure to keep a list of all the medications and products you use and share it with your doctor and pharmacist. Avoid taking MAO inhibitors while using this medication, as it can cause a serious and possibly fatal interaction. Also, it's best to avoid alcohol while using Jornay PM, as it can cause the medication to be released too quickly and increase the risk of side effects. In addition, it's important to avoid medications containing dexmethylphenidate while using Jornay PM, as they are very similar. Lastly, this medication may interfere with certain medical tests, so make sure your healthcare providers are aware that you are taking Jornay PM. If you suspect an overdose and the person is experiencing severe symptoms like passing out or difficulty breathing, it's important to call 911 immediately. Otherwise, contact a poison control center right away. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents can call a provincial poison control center for assistance. Symptoms of overdose may include vomiting, agitation, confusion, sweating, flushing, muscle twitching, hallucinations, seizures, and loss of consciousness. If you observe any of these symptoms, seek help immediately. It's important to remember not to share this medication with others, as it is against the law. Your doctor may also conduct lab and/or medical tests, such as blood pressure or complete blood count, and may monitor the height and weight in children while they are taking this medication. Be sure to keep all medical and lab appointments. If you forget to take a dose of Jornay PM, take it as soon as you remember on the same day in the evening. If you remember the next morning, just skip the missed dose and take your next dose at your regular time. Do not take a double dose to make up for the missed one. It is important to take this medication consistently at the same time each day for the best results. When storing Jornay PM 100 mg capsule, make sure to keep it at room temperature and away from light and moisture. It's important to not store it in the bathroom and to keep it out of reach of children and pets. When you no longer need the medication or it is expired, it is important to properly discard it. You can consult your pharmacist or local waste disposal company for the correct way to do so. Avoid flushing it down the toilet or pouring it into a drain unless specifically instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.